I'm so excited to talk about hormones, myths, science, and solutions today with you. There are so many misunderstandings out there about our hormones, about our health as women. And I'm going to explain and really break it down into why some of these myths have happened and the science behind it, and also some real practical solutions. And I know that there were some questions that were asked ahead of time, so I'm going to try and make sure we have time for that. And then if there are additional questions when we finish, then I'm happy to answer those as well. So I'm really excited to share this with you. I'm Dr. Trevor Cates, and I know I have to share a little bit of a disclaimer that this information is presented for your educational purposes only. It's not intended to diagnose or treat you in any way. If you want to have a doctor-patient relationship with me, you can, but this alone does not create a doctor-patient relationship. And what I really want to do is whether you work with me or you work with someone else, I want to empower you with information so that you can talk to your healthcare provider about what's best for you. There is not a one size fits all when it comes to women's health. And so today I really want to talk about how our bodies are vessels for our souls as light and wisdom. And it's really time to give ourselves permission to celebrate the incredible wisdom of our bodies and to help understand it. So the reason why I'm so passionate about this is I've been working with women for women's health for 25 years. I graduated from the National University of Natural Medicine, the Naturopathic Medical School that's located in Portland, Oregon. And I was the first woman licensed in California. I practiced there first and then moved, and now I'm in Utah. And I've written two books, Clean Skin from Within, Natural Beauty Reset. You may have a copy of one or both of my books. You may have also heard about me through one of my podcasts, the Spa Doctor podcast, or the Woman's Doctor podcast, or maybe the Hormones, Health, and Harmony documentary series, or maybe on somebody else's podcast. However you found me, or maybe it's the Facebook group. We have a Hormones, Health, and Harmony Facebook group. However you found me, I'm so happy you're here. And I truly am passionate about this because I've been helping women for 25 years, and also because I've been there too. I had, struggles with pregnancies, miscarriage. I had hormonal acne. I had a lot of skin issues that were related to my hormones. I also had, all the things that a lot of us have, PMS or period problems. And I also am going through perimenopause. So now I now know what that's like as well. And I know when I was 25 years old for seeing patients, I'm sure my menopausal patients were looking at me like, how are you helping women with their hormones? You have no idea what I'm going through. But now at 52 years old, I definitely know what they were going through and what many other women are going through, or if they are not going through it now, they certainly will, because we will all go through menopause at some point if we haven't already. So, I've seen it all with all the different hormonal transitions, and even for cycling women, all the changes that our hormones go throughout each month. So I get it. I know how challenging it is, and I'm very passionate about it, partly too because I've helped so many women over the years. And I've seen so many women come in to see me or read my books, do my programs, and be so relieved that they have the answers that they've been searching for. And that for so long they were given information and that just it was maybe not quite fully true, not really accurate. And so I'm so excited to answer your questions. I know we've got some questions popping up in the chat, and I'll answer those at the end. So great that you're here. And I do want to really bust through a lot of the myths today and the misinformation. I love the activity about hormones and hormonal transitions like menopause that are on social media, but I also see a lot of misinformation there as well. I see there are a lot of doctors or other healthcare providers with great credentials, but they don't have clinical experience. And so they may be reading the research, but I can tell you when you actually see someone in the patient room, it's very different than just what the books say or what the labs say or what the research say. Every woman is unique, and when it comes to hormones, we all work differently. So that's why I really wanted to do this webinar because I keep seeing information. I'm like, yes, that's true, but that's not always how women show up. And that's not what they all experience. So I'm excited to go through this presentation with you today. I want to share with you some things just so we're all kind of on the same page as, yeah, I know it can be hard sometimes. So, over 90% of women say they get PMS symptoms. Around 85% of women experience acne in the days before their periods. And this is adult women. And so, I know there's teenage years too, but we certainly can have a lot of acne. So many women experience that. And I know there were some questions about acne beforehand. So I want to make sure I get a chance to talk about that. 1 in 5 women are unable to get pregnant after 1 year of trying. So infertility or fertility issues. 1 in 8 women develop breast cancer during their lifetime. Women's risk for thyroid disease is 5 to 8 times more than men. Women are 4 times more likely to develop autoimmune disease. Osteoporosis is 4 times more common in women than men, affecting 1 in 5 women over 50. This is a big one. I want to point out, and I'm going to talk about that, why this is so important later. Heart disease. This is the leading cause of death for women, accounting for 1 in every 3 female deaths. And I know that other diseases get a lot of attention, but I don't want us to forget about heart disease. Women develop heart disease on average 7 to 10 years later than men. And that's because of the changes in our hormones. After menopause, women's risk of heart disease surpasses men's risk. Okay, so I know I wanted to go through that quickly because I don't want to, stay on the negative. Men certainly have their issues too. We're just talking about us today. We're talking about women. Why is it that we do have so much misinformation? Well, one of the reasons is it wasn't until 1986 that the National Institutes for Health established a policy that encouraged researchers to include women in studies. But it was not law until 1993. And that still so many studies are not including women. So we are behind the times when it comes to women and understanding hormones and health and how that impacts us in all different ways. And I could go and spend hours, days talking to you guys about this, but today we're just going to try and focus on a few things. Also, I want to talk some about women and aging too, because there are a lot of myths about aging and how we're expected to age and how we age differently. 50% of the US female population is 40 years of age or older. 55 million women in the US and approximately 1.1 billion women worldwide are postmenopausal. That means they're after menopause. They've already gone through it, and that number is climbing. The average woman can expect to spend 40% of her life in postmenopause. So if you're in that time of your life, you've got in great company. If you're not quite there yet, know that it is coming at some point, and you'll be in good company then too. So, according to AARP, 80% of graduating internal medicine residents do not feel competent to discuss or treat menopause. And I think this is one of the big reasons why women in menopause are so misunderstood. And close to 85% of perimenopause and menopause women experience a wide range of symptoms that clinically impact their quality of life. And despite the significant impact of symptoms on quality of life, 72% of women experience these symptoms do not receive any treatment. And 77% have not even discussed treatment options with their healthcare providers. And you would think that gynecologists would be the menopause experts, but I can tell you only 20% of OBGYN residents are offered menopause training. And half of the residencies that were surveyed felt they needed more education on menopause. So this is a big thing. So who do you turn to? Endocrinologists? No, they don't get trained in menopause either. So who do women turn to when it comes to our hormones? And I think that it is shifting. As a naturopathic physician, I could tell you the 25 years or the 4 years I was in medical school, we learn a lot about women's health and hormonal health and looking at a holistic approach. So understanding hormones is really important for yourself because you need to be able to communicate with your doctor, your gynecologist. These are the people you're going to go to that your insurance covers, and they're going to be doing your well woman checkups and things. And so I want you to be informed today, get you enough information that when you're talking to your healthcare provider, you know what's going on. Cassie, Cassie, no. Sorry, my dog barking here. Somebody just delivered a package at the door. Stop it. Stop. So understanding hormonal health. Hormones are chemical messengers that impact our mood, energy, metabolism, and reproductive health. They're chemical messengers in the body. And so that means there are hormone receptors over the entire body. So they really are important for our health in so many ways. And I think there's this misunderstanding that our hormones to be blamed for a lot of our health issues, but actually our hormones can work for us rather than against us. And so when I talk about hormonal harmony, and I like that more than hormonal balance because what does that even really mean to anybody? I like hormonal harmony, and you'll see that on my website, you'll see that on my book, you'll see it in my docuseries in the Facebook group. I like harmony because you can think of hormones as musical instruments and your body as a symphony. Each instrument must play its part perfectly, including the right rhythm, the right volume, pitch, melody, tone to create a balanced and beautiful sounding song. So that's what we ideally want to get to. So what disrupts our hormones? Many of our everyday habits do. Medications like birth control pills, endocrine disrupting chemicals, hormone disrupting chemicals, and these are in many places in our air, water, food, personal care products, and even alcohol is hormone disrupting. Poor nutrition, depending upon how you're eating, the timing, the quantity, the quality, the types of food, and also inadequate sleep. And that's not just the amount of sleep you're getting, but the quality of sleep. We're going to talk about sleep in a bit. And overwhelming stress when it's unmanaged. Stress is a certain amount is normal, but when it goes unchecked, when we're not managing our stress, that can disrupt our hormones. And also when we go through transitions, like when we hit puberty, of course, there are lots of changes there. When we get pregnant, postpartum, perimenopause, menopause, these are big transitions that can cause shifts in our hormones. And even just the aging process alone. Men also have changes in their hormones associated with aging. They don't have the transitions that we do, though. All right, so let's quickly go through some of the hormones, and then I'm going to talk to you about what you could do about these. So, estrogens are these fabulous hormones. We have a number of different estrogens in the human body. The main ones are E1, E2, and E3. E2 is the active one, the one that most people talk about too when it comes to treatment and bioidentical hormones. So estrogens help protect the brain, bones, skin, and heart. So it's not just about fertility here, people. Estrogens are really protective. And it's not just about managing symptoms, it's also about protection. Hormones do protect our bodies and especially our brains, bones, skin, and heart. Our estrogen levels decline as we age, especially in our 50s. And it does help with, it has a vasodilating effect So that it affects the effect of that is that it results in blood pressure benefits as well. Decreasing levels of estrogen also trigger skin changes, bone loss, hot flashes, insomnia, mood changes, night sweats, infertility, vaginal dryness, UTIs, urinary tract infections, and yeast infections. So take a look at these symptoms. It's not just a matter of hot flashes. I think a lot of people, will talk about, oh, mood or hot flashes, but estrogen is related to a lot of different issues. Progesterone provides protection to our skin, brains, bones, breast, and uterus. There's a lot of focus and talk about progesterone protecting the uterus. But it's not just protective for the uterus. So this is what ties into one of the myths out there, which is if you don't have a uterus, then you don't need progesterone when it comes to bioidentical hormones. That's actually not true because we need progesterone not just for our uterus, but also our skin, our brains, our bones, and our breasts. We have estrogen and progesterone receptors all throughout our bodies. So when balanced, progesterone helps us feel calm. When it's low, we can feel irritable and experience trouble sleeping. Progesterone levels generally start to decline in our 40s. Now, there are other times in our lives where we can also have drops in estrogen and progesterone. And cyclically women, when we're having our periods, we go through changes in estrogen and progesterone throughout the month. So even these shifts and changes, we can feel the difference throughout the month. And then when a woman is pregnant, she's got a surge of hormones. And then as soon as she gives birth, they just plummet. Those hormones go away. So if you had a hard postpartum, if you happen to get pregnant and have a postpartum, if you had a challenging going into perimenopause, may be harder for you because of your unique makeup of your hormones. Not necessarily, but it can be an indicator. So progesterone helps counterbalance estrogen, not counteract, but counterbalance estrogen. They're both important. It also aids in a healthy menstrual cycle. So when our progesterone levels are low, we may experience irregular or heavy bleeding, hot flashes, and night sweats. So that's why women, again, postpartum or in perimenopause, will experience some of these symptoms such as these irregular periods or heavy periods, hot flashes, night sweats. And then also women, there's this balance between estrogen and progesterone. And you may have heard of something called estrogen dominance. And it's not that estrogen is bad, but it's just that there's this balance between estrogen and progesterone. And when you have not enough progesterone in relationship to estrogen, you can have these low progesterone types of symptoms, or you can have what's called estrogen dominant symptoms like breast tenderness, heavy periods, and problems with your mood. So that's also something to think about with progesterone. Testosterone is also important for us. I think of this as mainly for men, but men and women, we all have the same hormones. We just have them in different amounts. And women who are cycling have them in varying amounts. That is estrogen and progesterone. With testosterone is really important for women's health as well. And this ties into another myth because uh, it's sometimes hard to get testosterone for women because it's not FDA approved for women in menopause or for women to be given. So it can be a little tricky sometimes, and it's a controlled substance as well. So testosterone is important though. It helps protect our bones and it protects our brains. It stimulates sebum producing glands. So it can trigger acne and unwanted facial hair growth, but it also can help protect the skin and with its natural oils and help with the aging process. So symptoms of low testosterone may include low sex drive, but it's not just about sex drive. It also can be brain fog, mood changes, fatigue, thinning and dry skin, muscle loss, and reduction in bone mineral density. It's bone mineral density is really important with estrogen, but also with testosterone. And part of that's because of testosterone helps us with our muscles. And when we have muscle loss, then that can impact our bone density because we need the muscles contracting on the bones to help strengthen them. And so with that risk in bone mineral density, that can make us at higher risk for fractures. And that definitely increases as we age. Okay, so we've got all these wonderful transitions in our life, and really it's leading up to menopause, right? And then what comes after menopause. So I know that there are people on this call in all different stages. So you might be in pre-menopause where you're in that normal reproductive time, maybe having, difficulties with your periods, maybe you're trying to get pregnant. And then there's this perimenopause time. And wow, is this a confusing time? And I see a lot of information on social media about this, and there's a lot of confusion, I think. But it's nice to see a lot of women talking about it. So I love seeing that. It really varies from one woman to another as far as when perimenopause will start. It can start as early as a woman's 30s. So if a woman is trying to get pregnant in her mid to late 30s or in her 40s, this can make it challenging because our hormones are already starting to decline. And for some women, that perimenopause starts early. And so usually that means a drop in progesterone first, followed by a drop in estrogen. And testosterone doesn't necessarily drop off. That really varies from one woman to another. But so you can start as early as your 30s, but generally by a woman's 40s, she's in perimenopause. Some women experience symptoms and some don't. Some don't even know what all the symptoms are, and that's partly why I wanted to educate you. I know my own mother, who's getting ready to turn 85, told me she didn't have any symptoms. She just went through menopause. She had one hot flash and she was excited she got it so that she knew what everybody was talking about. And that's what she tells me. But I think that now we're learning more about the signs and symptoms of perimenopause that are beyond hot flashes and sleep difficulties and low libido. So we know that there are so many other symptoms, including strange ones. But these are the different phases. And then we go through menopause, which is generally around 51, 52 years old, but it can really vary. Sometimes women are in their late 50s by the time they hit menopause. Some women go through menopause early, and there's also surgical menopause. So what a woman may have her ovaries, uterus removed, and then she goes through surgical menopause, early menopause, or for other reasons, she could go through menopause early. And then after that time, we head into postmenopause. So, as I mentioned, there are so many different signs of hormonal imbalances. So, period problems, breast tenderness, PMS or PMDD, which is a more severe form, PCOS, endometriosis, fibroids, hormonal acne, memory and mood concerns, and infertility. And then with perimenopause, you can have things like irregular periods, mood changes, insomnia, fatigue, dizziness, hot flashes and night sweats, we've all heard about, weight gain, especially increase in body fat around the abdomen or loss of muscle mass, brain fog, cognitive changes, vaginal dryness, infections in the like I said, urinary tract, or yeast infections, decreased libido, thinning hair, dry, thinning skin, joint pain, headaches, breast tenderness, digestive issues, and even worsening of existing conditions like migraines, allergies, or autoimmune disorders. I think some of these things really surprise people. And the list goes on. There are more than these. Like you may have heard about the itchy ears or the ringing in the ears, things like that that happen to women. There are some less common ones. But I'm telling you this to be aware, not to be depressed about it if you're heading that direction or you're in it. But or maybe you're on the other side of it and you're like, oh, wow, I had these symptoms and didn't even realize it. So, and then also in postmenopause, after menopause, we can have vaginal and urinary changes. We might experience increased dryness, discomfort, urinary tract infections, and incontinence. Weight gain and metabolism slows down, so you may notice changes in your weight, and you also could be at higher risk for diabetes. Brain fog, memory issues, difficulty concentrating, forgetfulness, cognitive decline, mood shifts, and anxiety, sometimes more depression, irritability, skin, hair, and nail changes, pain and stiffness can occur. Sorry, drinking a little bit of water here. Estrogen decline worsens inflammation, and so it can create more of that joint pain and stiffness. Sleep issues and insomnia, heart disease risk increases after menopause. So you might start noticing that you're getting high cholesterol. Your doctor is talking to you about this. High blood pressure, cardiovascular issues. Wait, what's happening? Have these issues before. After you go through menopause, all of a sudden these are showing up. I see this so often in women. Also, bone loss and osteoporosis, greater risk of fractures, as I mentioned before. So again, I don't want you to be depressed about that. I just want you to be aware of all the things that can be going on. And I've talked about our sex hormones, estrogen, progesterone, and testosterone. But we also have other hormones too. And I don't have time to talk about all of these, but they are interconnected. We have our stress hormones like cortisol. We have our sleep hormones like melatonin. And also, cortisol and progesterone can impact our sleep. We've got neurotransmitters like serotonin, which is also a hormone. We've got metabolic hormones like thyroid. These all work together. They don't work in silos. They're like friends. They're like part of the symphony. They do communicate and they need to communicate with each other to stay in balance. Okay, so I know I've covered a lot and this is recorded. So if you want to go back and listen to anything again, you can, because now I want to talk about how do you know what's going on with you? What you know what symptoms you're having, but what's related to your hormones. And we talked about some sex hormones, but we also talked about other hormones. So lab testing is really helpful. And as a naturopathic physician, I don't just look at blood work. I also look at urine, saliva, I look at specialty labs, and I also look at optimal ranges rather than just the normal standard ranges. So when you're talking to your doctor and they're saying, oh, we don't need to do labs, or we've done labs and everything's normal. I would ask for a bit more information. And I'm going to tell you how you can dive deeper into this. I have a group program coming up where I'm going to help you really understand your labs better. And so if that's something that you're interested in, then stay to the end, because I'm going to also give you a way to get a discount on that today. So yeah, so blood work is great for things like thyroid. It's also great for looking at things like cholesterol, or looking at your red blood cells and things like that. And it also can be used to look at things like estrogen or estradiol, progesterone, testosterone, DHEA, those kinds of things. But you also can look at urine, and I really like to do all of these. I like to do blood for some of the things that I mentioned already. I like to do urine testing because, like the Dutch test that some of you may have heard about, which is a urine test, those look at the metabolites of your hormones. And so if you think about your urine is coming out of your body, so your body's breaking it down, that's what's coming out. So that's how your hormones are breaking down and what's excreted in the urine. And so that gives us information about not only if your levels are high or low, but how your body is processing the hormones. Because this is one of the biggest things when it comes to our hormones. And especially if you're on bioidentical hormones, there are some pathways, some people, some women metabolize their estrogen and testosterone in particularly, but also progesterone differently. So for example, with progesterone, some women have metabolites that give them a really feel good feeling around having progesterone. But some women don't have that. And so when some women are given progesterone, they don't feel good. And so there's a reason for that. Another example is estrogen. We have three main types of estrogens, and we also have different metabolites. Some of the metabolites of estrogen are put us at higher risk for things like breast cancer. Some of the metabolites put us at higher risk for osteoporosis. So knowing what the metabolites are and how well your body is metabolizing is extremely valuable information. And the Dutch test also looks at things like how well are you metabolizing your methylation pathways and things like that are helpful. Saliva is really helpful for looking at cortisol. That's why when I particularly like to look at saliva. And then again, we've got the conventional versus specialty. Specialty labs are like Dutch tests, but there are also things like looking at nutritional deficiencies, gut tests, especially if you have things like acne or you're trying to get to the root causes of why are my hormones out of balance? I'm not in perimenopause, or maybe I am in perimenopause. I'm going through a really rough time. Why is that happening? Well, there might be some other specialty labs that can really help you get to the root cause of why you're having these challenges. Because I can tell you, there are all of these things that we can experience, but I feel great. I'm 52. I work hard. I look at my labs. I do all the lifestyle things. I take supplements. I do bioidentical hormones. I do and I exercise. I do all the things and I work hard at it. And then sometimes I do get symptoms, but I know to be proactive with it. So it's not like you have to just put up with it. And labs can help you get more information. When it comes to the approach that I really recommend, it's a holistic approach. Hormones naturally fluctuate and decline as we age, but we can optimize their production, their function, and their balance. And that includes that metabolism I was talking about by addressing the root causes. So these are some of the root causes that I really think are important to look at. Things like nutritional deficiencies, there are certain nutrients that we need to help us with our hormones to keep them in balance. Metabolic issues, inflammation, gut disturbances. This is a big one I see oftentimes, and this ties into the metabolism, how you're metabolizing your hormones your liver, your gut health. Maybe you have some gut dysbiosis issues, some imbalance in your gut flora. Also, sleep is important. Are you getting sleep? And what's going on with that? Stress and toxin exposures. So these lifestyle factors play a huge role in helping our hormones. And so one of the things that another reason why I really wanted to do this webinar is that there's so many doctors out now that are saying, yes, I'm going to start giving hormones to my patients and I'm going to start prescribing them. And maybe they're even doing bioidentical hormone therapy, which is great, but they're not doing this stuff. And it concerns me because you've got to build a healthy foundation for your body before you start adding hormones in. It's really, really important to make sure that you're doing everything to support your sleep. And of course, hormones can help your sleep, but what else are you doing for your and your lifestyle to help support your sleep? What are you doing in your lifestyle to help with your exercise? What are you doing with your diet? What kind of community and support system do you have? That does make a difference. How are you managing your stress? Are you exposed to, we all are exposed to endocrine disrupting chemicals, but what are you doing to reduce your exposure? And what are you doing to make sure that your liver, your kidneys, your lymphatic system, your digestive system is doing everything it can to eliminate the toxins you are exposed to in your air, water, food, and personal care products? So let's talk about some of these things in a little bit more detail. Stress management, mindfulness, relaxation, anything that you can do regularly, do it. And so figure out what works for you. Breathing is free. You're doing it already. Just put a little bit extra focus on it. That can be one of the most powerful things you can do. Take a few minutes to focus on your breath. Slow down. Do a count of 3 or 4 in, 3 or 4 out, and then also looking at things like meditation practices, yoga, maybe even just getting some exercise. There's a balance when it comes to exercise. I live in Park City, Utah, and sometimes I have patients and I have to tell them to slow down because they're overdoing it with their exercise. Because if you're doing too much, then you could also increase your cortisol, get too much, and your body's responding with stress. But generally, regular moderate exercise reduces cortisol, that stress hormone. It also boosts serotonin, our feel good neurotransmitter, and supports our circadian rhythm, helps us with sleep. Sleep, so important. One of the things that can help is establishing a consistent sleep schedule. So that means going to bed at the same time and ideally waking up at the same time. But it's most important to go to bed at the same time every night. And I know it's hard because sometimes you have to get up early in the week. You don't want to get up early on the weekends, but that can throw you off a little bit. So when you go to bed at the same time, you're creating these rhythms for your body. And then your waking becomes more automatic. So you don't have to worry as much about the waking, but within reason, of course. Maybe you need to set your alarm for a while to get you in that rhythm. And set yourself up for success, create a restful environment, minimize light, noise, and maintain a comfortable temperature, especially if you're going through menopause and you're having the hot flashes and night sweats. Limit screen time before bed. I know it's not easy because we're all about electronics these days and blue lights, but you could also get blue light blocking glasses or protectors for your screens. But I really do encourage you just try and turn it off before bed. So read just a good old-fashioned book or listen to some music, engage in some nice conversation, do some breath work, whatever you could, take a bath, find a way to relax and really help support your body. That melatonin hormone helps you sleep. And so when you have exposure to light, it's not allowing your melatonin to kick in. And then also when you wake up in the morning, getting outside and getting your eyes exposure to sunlight is a great way to also help melatonin. So it's not just about the evening, but also in the morning. So let's talk about food for a bit because food is always a big topic. And also, if you haven't seen already on my website, drtrevorcates.com, drtrevorcates.com, I have a pop-up, you're on the website, if you're on there and you either get ready to leave or you're there for a moment, you'll see a pop-up and it'll say, would you like to get Dr. Cates's hormone balancing food guide? I would recommend getting it. It's got more information than this. If you have my books, you'll also have a lot of great information. I have 2 books, Clean Skin from Within and Natural Beauty Reset. So there's a lot of information, tons of information in there about food. My first book, Clean Skin from Within, is more focused on skin. So if you have skin issues like acne, I highly recommend getting that. And then my second book, Natural Beauty Reset, is about hormone balancing food. So that's what we're talking about today. So I'm guessing most of you are going to be interested in more for my second book, Natural Beauty Reset. If you don't have a copy of it yet, you can get it on Amazon or wherever books are sold. And I'm going to tell you in a moment how you can also get a free copy. So high fiber is great to help with our digestive system, our blood sugar balance, and it helps our hormones. Diversity of colorful produce. So that means they're rich in antioxidants. Also getting, which are protective for our bodies and also help with our hormones. Cruciferous vegetables, those are like broccoli, cauliflower, kale, that whole family. They help with estrogen metabolism. They contain DIM you can actually take it as a supplement as well. Plenty of protein. This is important, especially as we get older. We need plenty of protein. I'm not saying you should be a carnivore. Please don't, because you still need your cruciferous vegetables and your colorful produce and your high fiber diet. You still need those things, but you also need plenty of protein. And those can come in the form of wild fish, nuts, seeds, eggs, free range, and grass fed meat. And then also omega-3 rich foods, that's in the wild fish, but those help reduce inflammation and support brain and hormonal function. Magnesium, so many people are deficient in magnesium. I end up putting a lot of women on magnesium supplementation, either in the form of citrate, malate, or L-threonate. These can really help support our sleep. You can get them in your food, nuts and seeds, leafy greens, even dark chocolate. But dark chocolate usually has lots of sugar in it. So unless you're like me and you'll do 100% dark chocolate, may be better to stick to the other ones. You want to minimize sugar in highly processed food. I'm not a food shamer, not I'm more about a food promoter. So just focus on the good stuff, and the other stuff just kind of, the less important stuff usually melts away. If you focus on the things that I just talked about, you probably won't be craving as much sugar and processed food. And drink plenty of water, limit or avoid caffeine and alcohol, because they do interfere with liver function, which then can interfere with your hormone metabolism. So, supplements and hormone replacement therapy, I get tons of questions about these. It is very, very individual. It depends upon your symptoms, what your goals are, and your lab results. So, something to really work with your healthcare provider, whether that's me or someone else. But I will give you some general advice. This is also in my book, Natural Beauty Reset. There's a lot more detail. This is in the final chapter of the book. I talk about whether your hormone is low or high, and how to know like some of the symptoms associated, and then some things that you can do for each. And I'm just going to go through some of the low ones, but in my book, I also talk about like if your estrogen's high, what you can do about that too. So, because I know a lot of people signing up for this are in the perimenopausal low range. So, if you have low estrogen, you can do things like eating phytoestrogens. These are naturally occurring plant compounds that function like estrogen. They're not estrogen, but they function like estrogen in the human body. So flax seeds, sesame seeds, non-GMO soy, and rhubarb. Maybe skip the strawberry rhubarb pie unless you can find a nice healthy version of it. Stress management is also important for estrogen. Mindfulness approaches like yoga can help improve estrogen. Supplements, vitamin D, wild yams, you've probably heard of melatonin, which you think it's only for sleep, but also helps your estrogen. And melatonin, when we turn 50, and both men and women, we stop making as much melatonin. Our melatonin production declines. So, something to think about. Black cohosh, especially for women, like hot flashes, curcumin, vitamin E, and maca. And not all of these raise estrogen. I'm not saying that these like work like bioidentical hormones where they raise estrogen, but they help support the pathways for estrogen. They help support some of the symptoms associated with low estrogen, like black cohosh and hot flashes. So, and maca is another one. But really work with your healthcare provider. It's such an individual thing. Low testosterone, really want to focus on consuming plenty of protein and healthy fats. So, need those in order to make testosterone. Stress management, again, stress management plays such a huge role in hormones. It really blocks the production of our hormones. So cortisol suppresses our stress hormone suppresses testosterone. So be sure to include stress management. exercise, and that can actually help support your natural androgen levels when you're exercising regularly, especially weight-bearing exercises. And you can ask your doctor to test your vitamin D levels, 25 hydroxy vitamin D, and if they're low, then taking some vitamin D could be helpful. There's some research that suggests tribulus and zinc supplements can help support healthy testosterone levels in women. And I talk about dosages in my book. So low progesterone include foods that contain vitamins and minerals like zinc, vitamin C, vitamin B, magnesium, and cruciferous vegetables help support estrogen metabolism. So if you have like estrogen dominance where you've got high estrogen in relationship to progesterone, that's going to be particularly important for you. But this is when those nutrient deficiencies can come into play, when things like birth control pills create vitamin B deficiencies. And certainly there are a lot of people walking around with zinc deficiencies, magnesium deficiencies, and vitamin C is something that we need every day. So these are things that are good to have either way, but particularly for low progesterone. Moderate intensity, as I mentioned, you don't need to overdo it with the exercise. That's just going to increase your stress. Stress management's here again, high cortisol suppresses progesterone. Supplements like chaste tree berry, melatonin, evening primrose oil, vitamin C may help. Again, talk to your healthcare provider about these, and I talk about them more in Natural Beauty Reset. Okay, I know some of you want to know about hormone replacement therapy. I don't want to spend a ton of time on this because there is so much, and we could spend an entire webinar just talking about hormone replacement therapy. So, but I do want to talk about it whether you're in perimenopause, postmenopause, or you know it's coming. It's good to know about hormone replacement therapy. So it's used to supplement or replace hormones that the body no longer produces in the right amounts. So this is typically in menopause, but this can also happen postpartum. There are some women that need a little bit of like vaginal estriol or a little bit of progesterone or things like that uh, after giving birth. Or in order to help with a healthy pregnancy, progesterone is oftentimes helpful for especially women as they're getting older and their levels are declining. But really, we're talking more about perimenopause, menopause, postmenopause. It comes in so many forms: pellets, injections, oral, patches, topicals. So you choose right what's best for you and work with your healthcare provider. I personally don't do pellets. I know some people love them, but they personally, they make me nervous because once they go in, they're not easy to get out. They create a lot of hormones, and you can't. I tend to see the women who are sensitive to things, and so I like to start low with hormones, and I feel like I can do that better with topicals, especially for estrogen and testosterone. I do like some of the patches out there for estradiol in particular. I think that can be really great, especially if you're kind of forgetful and you don't always remember the creams or taking something orally. I'm not a big fan of injections either, but some people find those work great. I'm not saying that there's a one size fits all. I'm just saying pellets and injections are not the way that I go. The oral, as far as oral, the only one that I typically give oral is progesterone. And that's because for some women, it helps with the sleep, the mood symptoms more than the topical. And then because when you take things like estrogen, if you were to take it orally, it goes through the liver. And there's some concerns about that. It typically works better topically. So there's some of the misinformation about hormone replacement therapy came from the Women's Health Initiative study. And I remember this really well because I graduated from medical school in 2000. And this came out shortly afterwards. This is 2002. And this led to widespread media coverage and public's concern about the safety of hormone replacement therapy. So if you've been wondering, why did I hear that hormone replacement therapy is safe, that it's dangerous? It came from this study, most likely, because this was a large study and it was halted. But now looking back at this, we now know that keeping women off of hormone replacement therapy all these years has actually, in most cases, has done more harm than good. So I want you to understand that the Women's Health Initiative study was done with oral hormone therapy and Premarin and Prempro. So Premarin is from pregnant mare urine. That's what the abbreviate. That's why it has that name, pregnant mare urine. So this is equine estrogen. This is not hormones that are the same as ours. These are they're molecularly different than human estrogens. And then the progestin was, or the Prempro is the synthetic form of progesterone, not bioidentical hormones. So these are not bioidentical hormones that were done in this study that caused all doctors to stop prescribing hormone replacement therapy. Now, I can tell you, I've been a naturopathic physician since 2000. And I went and studied with Dr. Jonathan Wright and who's been doing hormone replacement therapy longer than anybody else in the US. I think he started it in the 1980s. And then I've also studied with naturopathic physicians, and we were doing bioidentical hormones. We weren't doing this stuff. So I never stopped doing hormone replacement therapy, and my patients were very happy about that. But it's great to still see. So I've been doing bioidentical hormones for 25 years. And some people are new to this landscape because bioidentical hormones have now become more popular because information has come out about this Women's Health Initiative study that it was flawed for many reasons beyond even what I have on this slide. And I'm not going to go into it all today, but there were a lot of people in the study that were over the age that should have been used, that really looked at, and that also were already had other health issues, other things going on that were put them at risk, like obesity, smoking, unhealthy lifestyle, and that played a role. So lots of other things. I'm not going to go into all that, but let's talk about bioidentical hormone replacement therapy, BHRT. So these are molecularly the same as our natural hormones. So our bodies can have an easier time discerning how to properly use them. When we get exposed to them, our body goes, oh, I know what to do with that. We make that so it can use it properly. As I mentioned, there are three main types. Most of what's prescribed is estradiol. I sometimes will do what's called biased, which is estradiol and estriol, because estriol is also can be protective, especially for like vaginal dryness and vaginal tissue. Progesterone is not progestin, but progesterone is bioidentical. Testosterone, DHEA, these are bioidentical hormones. If they come in other names, it might be, like the name of the estradiol patch, or something like that. But look at what's on it, and it should have one of these names. If not, then you may not be on bioidentical hormones. Okay. Then it's, the question is, oh, what's right for me? What's right for you? So it all depends upon what's going on for you. A lot of it might be your symptoms, but it shouldn't stop there. I've heard so many women say, well, I'm going through perimenopause and I'm not having symptoms, or I'm in postmenopause and I didn't really have a hard menopause. I'm doing okay without symptoms. Okay, but it goes beyond symptoms. As we've talked about, there are a lot of symptoms related to hormonal decline. So, of course, bioidentical hormones are going to be helpful for that. But we also have this huge category of disease prevention that I don't want you to miss. This is so important because this is what we learned by taking all these women off hormone replacement therapy because of the Women's Health Initiative study. And I'm saying we, I don't mean I didn't, but other doctors did, and medicine. So what happens is there's an increased risk for osteoporosis, for dementia, cardiovascular disease. So these are things you definitely want to consider, especially if they run in your family. But even if they don't run in your family, just having these hormones decline overall put you at so much higher risk. So I encourage you to think about these things. And I know there were some people that said, I'm in postmenopause. Should I come to this webinar? Is it meaningful to me? And yes, this is partly why I wanted you to come, because I want you to understand that it's still important for you to look at how you can support your hormones, because your ovaries aren't making them anymore. And sure, we get some hormones from our adrenal glands and we get some from our fat cells. Maybe that's why our body naturally just puts on a little extra cushion for us so that we have those hormones. But we don't get as much from those as we did from our ovaries, so it doesn't provide as much protection. But you also need to look at your risk. Do you have you had breast cancer? Are you at risk for breast cancer? They're actually saying now that even women who've had breast cancer, if they've been clear for 5 years or more, but they're having a lot of symptoms, and that they would benefit, maybe if they're also at risk for osteoporosis, that it could be good to actually do hormone replacement therapy. Also, what's your lifestyle like? What are your life goals? Are you wanting to still have a sex drive? Are you just going to be like, I'll just grin and bear it through the vaginal dryness and the discomfort and the yeast infections? Or do you want to actually still be active and enjoy life and be free of symptoms and also protect your health? Do you also have access to a healthcare provider who can help you with this? So these are all the things that you have to think about for you. So I do have some support for you. I want to share some information about what I have coming up. If you haven't heard about it, I have two ways that you can work with me. One is a group program and one is one-on-one. And you can find out more about these at drtrevorcates.com if you go to the services section on the website. So this is what my website, when you get to drtrevorcates.com, if you click on services, you'll see this page, and then you can scroll down and you'll see these options of what is in the programs. I'm going to put it here on the slide so you can actually see it better, because it's kind of hard to see on that slide. So the two programs I have a group program. It's a Hormonal Harmony Reset Group Program. This starts September 23rd. And this is a group program. This is an educational program. This is great for you if you want to. This has been not enough information. You want to dive a little bit deeper. You need more help. Maybe you already have a healthcare provider, or maybe you live somewhere where you can't come see me in Utah. This could be good for you. So it's 4 weekly recorded call sessions in the first month. Then we go to 5 monthly educational calls. This is a 6-month program. And you also get digital access to my 10-part documentary series, Hormones, Health, and Harmony. And we'll be going through that together and really kind of helping talk about more about busting some of these myths and misunderstandings. I'm also going to share seasonal digital workbooks for fall and winter, because we'll be going through 2 seasons together. And my book, Natural Beauty Reset, has a seasonal plan. So I really believe in shifting things up, and our hormones actually do change with the season. So you get to understand through 2 seasons how to support your health and your lifestyle. So we'll be talking about food, movement, mindset, skincare. For those of you who don't know, maybe you don't know, I started a skincare line called the Spa Doctor 10 years ago. I sold it 2 years ago. Still supporting the company, helping them with product development ideas, and I do some videos and things like that occasionally for them. But yeah, so skincare is something I know a lot about. So helping you with skin, I'm here for you. So this is you also get access to a private supportive community, online community. And so we're going to be talking on these calls more detail than what we've covered today. And I'm going to answer all of your questions. And I know things will come up about the foods, about the supplements, about labs. And we can go through, I mean, I can't look at your individual labs and give you information if we don't have a doctor-patient relationship. But I'm going to talk about in general what to look for in optimal versus normal ranges. I'm going to be talking about things like cholesterol. So common for women's cholesterol to go up. It's common to see things with our thyroid, with cortisol, with our hormones, and vitamin D and all those sorts of things, and what to look for with more optimal numbers. So that's the group program. This is not a doctor-patient relationship. If you want to work one-on-one with me, I am now accepting new patients. I generally open up my schedule in the fall for a little while. So we're just getting ready to head into fall. So I've opened up my schedule and I'm offering a personalized 6-month hormone reset program. So with this program, you get a 60-minute initial consult with me. We go into a comprehensive one-on-one. This is you, all about you, your labs, and everything that you need. And it also includes 8 follow-up appointments every 3 weeks over the 6 months. And then you get ongoing guidance, accountability, and we can just adjust as we go. You also get a copy of my book, Natural Beauty Reset, and you get access to the group program. So the group program is $9.97, and or you can do it at $197 a month. I'm going to tell you how you can save money on this in just a moment. If you want to do, so that's included in the one-on-one. If you want to work one-on-one with me, it's $24.97. And that's just while I have availability, and I'll keep that open until I don't have enough space anymore, and then that door will be closed. But the group program is open until September 23rd, and then I'll see how many women we have in the group, and then I can decide if I can continue to add. But my plan is to cut that off on the 23rd because I think we'll probably have a good group by then to get started. So if you are interested in either of these, here is a coupon code to use. It's valid for the next 72 hours to get $75 off on either program. So you can do either one. So again, just go to drtrevorcates.com, go to the services, scroll down, and you'll see the 2 different options. You can read through all that. Take your time over the next 72 hours to see which one you want to do. And then when you're ready at checkout, when you get to, go enter your information, use webinar 75. And again, this is only valid for 72 hours. So try and make this decision soon. And if you're really not sure, you just don't know, scan this QR code, take a screenshot of this. You won't find this on my website. This is a way to get a free 15-minute call with me. This is a discovery call. This is not entering into a doctor-patient relationship. I cannot give you medical advice. But if you just want to know, should I do the group program? Should I do the one-on-one program? Are you the right doctor for me? I don't know yet. Schedule a 15-minute free call. If you go on my website and do this, you'll have to pay $25. I have to do that because I have to screen out people who are just uh, either trying to sell me something. I've gotten all kinds of weird calls, but I know those of you on this webinar are good humans. You're gonna take this 15 minutes with me, and really only schedule this if you are serious about working with me in either the group program or the one-on-one. I should say with the one-on-one program, I'm licensed in Utah. So you should be living in Utah or willing to visit Utah. You need to be a Utah patient because I'm licensed in Utah. So that is, I am looking into possibly reactivating my California license. I was the first woman licensed there, and I had license number 3, but I let it go. Now I'm thinking about trying to get it back. But also, there's my book, Natural Beauty Reset. I encourage you to go on Amazon, get a copy of that. There's tons of information in there. I think it's less than this now if you go on Amazon now. And I am going to go ahead and open up for some questions.